It's my pleasure to introduce Dr. Ross Ellenhorn.
Thank you.
Anyone on earth who uses any search engine and plugs in the word addiction, our definition, the Psychology Today definition and discussion of addiction is going to be the number one result that comes up and will be simply the most looked at module on addiction available to people. We understood that this is our most searched for term, and therefore we examine it carefully, make sure the information is up to date. And I like to take on these challenges, so I took it on because I like to be very comprehensive about it. And that's what I did. I sort of went down the rabbit hole of addiction. And I looked everywhere I could, of course, starting with the government definition of addiction. And not just definition, but information about it. And I really kept tripping over this idea of addiction as a disease. Where is the disease? What is the disease? And what is the cure? And I understood as I was researching, it struck me that calling it a disease definitely is an attempt to take away the stigma. I think it's not an effective way to take away the stigma. I can't quite wrap my head around how that reduces stigma, to be honest with you. But, I mean, that's kind of a common way of thinking these days. And if you want to reduce that to what it really is, it's kind of a form of political correctness. And, but I still was very open-minded and searching. But the more I looked, I thought, well, calling it a disease means there's a problem, there's some biological problem. I never could find what it is. And of course, as a person on the receiving end of so much news, every day I'm getting 20 news releases that this is the cure for addiction. Of course, we never have the cure for addiction because, as I came to realize, there is no single cause of addiction. One of the things that really struck me in the course of looking through all the material was that, I know this is heresy to say, but at some level, in certain situations, not to condone it. There's a way in which addiction makes sense. I mean, if you take someone living in an area of the country that has someone who's barely graduated high school, has few job opportunities, lives in an area of the country where industry is fleeing, things are on their way down, it's doomy and gloomy, there are very few opportunities, few dating and mating opportunities. We're all designed to want rewards in life. It seems to me that under those circumstances, getting some immediate rewards, regardless of the enormous collateral damage that gets done, there's a level at which that makes a certain amount of sense. I'm not condoning it, but it suggests that the solution is not some other agent, some drug that's going to do something to your nerve endings, but to give that person opportunities, hope, job, other avenues of meaning, so that they take the behavioral path and find more in it most days than going, to the direct, injectable, inhalable root to your nerve endings. And it disturbs me that we keep going down this path of thinking of a cure for addiction, because I am sure there must be researchers out there who need to get fundings from our cultural arbiters, the National Institutes of Health. They need to get funding from these organizations. But how do you warp the truth to fit into the paradigm of disease? It seems to me that this is hampering our way of dealing with addiction, not really helping it. It seems to me that we're throwing good money after a bad idea. That really bothers me.
So that's Hara Moreno, who's here today. She's the friend of mine, and she's the editor-at-large for Psychology Today. And if an archaeologist were to look at sort of the changes and how we're thinking about paradigm shifts someday in the future, this would be an example of one place where we're shifting the frame, the way that we think about addiction. She mentioned issues of opportunity and lack of opportunity. She mentioned meaning and connectedness. And she mentioned a very serious concern about how the disease model works to kind of frame this issue. And I'm actually involved in this conference, and I'm involved in a conference called Attachment Addiction in Boston. And the purpose of both those conferences is to try to kind of help this movement towards a change in the paradigm. And my job at these conferences, because I'm trained as a sociologist too, is to sort of give an idea of what a paradigm is and to give you a picture a bit about where those changes are happening. And when I do that, I'm going to have to be a little black and white. So when I'm insulting to one kind of way of doing things, I'm actually more ambivalent about it than it may sound, but I have, for time purposes, I'm going to kind of talk about critically about some ways in which we treat addiction. And this picture here, and I like to say his name because it makes me sound fancy, is from Wittgenstein, and it's about seeing as. So you can't look at that picture and see a rabbit and a duck. All you can see, really, is a rabbit or a duck. It's about seeing as. And paradigm shifts are shifts in the way we see as. They don't happen because we've collected enough data, and then because of the progress of science and thought, we shift over to a new way of thinking. They happen because of all kinds of issues, and a lot of those issues have to do with power relationships. The other way to think about a paradigm shift is as a field. And this is from Gestalt therapy. And one of the most famous ways in which one of the Gestalt theorists sort of came up with the idea of fields is he's in a friend's house and he sees a baby and it's reaching for a toy and it's in front of a father and a mother and they're not quite paying attention, and he's terrified that this baby is going to knock over the ashtray, maybe knock over the lamp, bump his head. And that's his field because he's watching the parents. But then the baby calls his parent over to get the toy. The baby's field is almost the opposite. The baby's not scared at all. The baby's not frustrated at all. It's got a different field of vision. And that's what paradigm shifts are. They're these changes in our fields and how we look at things. And that requires more than just scientific discovery. Okay, you got a guy in his 50s who discovered Prezi, so you got to live with that today. So let's start with disease. This idea that addiction is a disease, there is some science behind that, but it's also sort of talked about as a metaphor, as a way of kind of describing this event. And disease is an important way of thinking. A disease is something where there's something functionally wrong with you. It's not about what's happened to you, like an injury, which is what we call trauma. It's about something functionally going wrong with you. It's about what is wrong, not what is happening. And when you're diseased, your job is to go seek the person whose job it is to remove disease. That when you're diseased, you're actually doing something wrong if you don't seek medical help. And when we think of medical help, we think about something in which we intervene. Intervention, that term that's often used in the substance abuse community, means to cleave or remove something from something passive. We also use it for acts of war, right? It's a moment where you step in, and the thing that you're removing it from, it's like removing a cancer tumor. You're stepping in and you're surgically removing that. And that's sort of how we think about disease. It's something that somebody else cures, that we're not necessarily a part of. Now, this idea that disease, that Hara brought up, that a disease model helps free people from stigma because it frees them from their moral responsibility. For us sociologists, steam starts coming out of our ears when we hear that. It's a very frustrating thing to hear because we know that the evolutionary purpose of stigma is to remove people from the gene pool who are diseased. And so this idea that disease is going to cure this issue of sort of saying somebody's doing something wrong when they're using is saying we're going to stigmatize people in order to free them from stigma. But there's other problems with this disease model that us sociologists know about. Every role we play in society has rights and responsibilities. And so does the patient role. When you're a patient, you have certain rights. Just like I have rights as a father, but I also have responsibilities. And I can't just live within my rights. I also have these obligations. And the patient role has certain rights, certain things that you're granted because you're a patient, but it also has obligations. One is you're not responsible for your condition, right? That's where you get that kind of moral freedom, because you're not responsible for this happening. That's a right. That's sort of what they're talking about when they say that you're freed from stigma by being called disease. And you're exempt from normal social roles. You don't have to go to work when you're sick. You may go away for treatment when you're sick. So those rights are there. But they're also connected to obligations. That every system that gives us a role, gives us rights, tells us that we're free, even free from sin, even free from stigma, but it also expects something out of us. Patient role, you're doing something deviant and wrong if you don't try to get well. That's a moral issue. You're bad if you don't get well, if you're a patient, if you don't try to get well. So if you say you don't really want to fix this thing, you're doing something bad. And you have to cooperate with experts. There are people out there that know better about what's going on for you than you do, and you need to follow what they're telling you. That's also part of having a disease and seeing a doctor. I almost only comply with what my doctors tell me, probably to bad ends in some ways. When I have questioned their opinion, I feel like I'm breaking some major rule in doing that. I don't know if you've had that experience too, but I feel like I'm stepping out and doing something scary. And that's because I'm not acting within my role, which is to comply. There's a part of the book in AA that says that if you just follow the 12 steps, everybody will get well. And if you don't, something's wrong with you. We can't figure out who these people are, why they can't comply, but they have some problem with the ability to be honest with themselves. Something's wrong with them in not complying. So one of the really greatest thinkers on this issue of what it is to be a patient, what it is to rely on experts, and what it is to be sort of within this disease model, most of you have probably heard of this guy. His name's Michel Foucault, French philosopher. Us sociologists like to call him a sociologist. We do that a lot. And he had this idea, knowledge is power. He didn't mean that the smarter you get, the more books you read, the more powerful you are. He meant the people that decide who's normal and abnormal are exerting an act of power. When I decide that your behavior is abnormal and diseased, I have significant control over you. And Foucault was particularly interested in this thing he called the clinical gaze, which is this way in which you're looked upon by experts where you can't look back. You're not able to make judgments about them and what's happening to you. And it's a very controlling experience. Now, when you go to the doctor, you don't go to the conversation room or the dialogue room or the collaboration room. You go to the examination room. And my life has been saved by being examined, and so have family members of mine. So there's beautiful parts of, major parts of medicine, most of medicine, that does this beautiful thing of examining and looking and figuring out. But when it's applied to behavior, it becomes an act of power, because we're deciding who the abnormal are and who the normal are. Another example Foucault gave, which I think is a really kind of marvelous one, is the panopticon, which is these towers in prisons they developed where you can't see the guards, but they can see you. And it begins to make you sort of take care of your behavior and try to act as normal as possible. And we now have this year a pill that's like swallowing a panopticon. It's a pill that has a chip in it, Abilify, Mycite, and you swallow the pill and your doctor's phone beeps and says that you took your medication. So what happens when we're in this kind of system where we're called diseased, and some expert has called us as disease, is we end up sort of taking on a passive role. We don't really have much power in that. And we end up sort of voluntarily engaging in processes that aren't necessarily good for us.
Do you want to say something to the group, Mr. McMurphy?
Well, yeah. I'd like to know why none of the guys never told me that you, Miss Ratchet, and the doctors could keep me here till you're good and ready to turn me loose. That's what I'd like to know.
Well, fine, Randall. That's a good start. Would anyone care to answer, Mr. McMurphy?
Answer what?
You heard me, Harding. You let me go on hassling Nurse Ratchet here, knowing how much I had to lose, and you never told me nothing.
Now, Mac, wait a minute. Wait a minute. I didn't know anything about how much. Wait a minute. Now, listen. Now, look. I'm voluntary here. See, I'm not committed. I don't have to stay here. I mean, I can go home anytime I want.
You can go home anytime you want.
That's it.
You're bullshitting me.
No.
He's bullshitting me, right?
No, Randall. He's telling you the truth. As a matter of fact, there are very few men here who are committed. There's Mr. Bromden, Mr. Tabor, some of the Chronics, and you.
Cheswick, you're voluntary?
Mm-hmm.
Scanlon? Billy, for Christ's sakes, you must be committed, right?
No.
Okay. Here.
We live within these frames of disease, these paradigms or fields, and we end up complying and becoming kind of voluntary in ways that really give up our own uniqueness and our depth. Because we're being told that there's certain ways of behaving that evidence a disease and certain ways of behaving that evidence that we don't have the disease. This isn't exactly a happy talk, is it? So there's one more thinker I'm going to talk about, and I am, by the way, going to get to addiction and addiction treatment. And that's a guy that's kind of taboo in our world these days. He came before Foucault. He's another person we like to claim, our sociologists like to claim as a sociologist, and that's Marx. And he talked about how our ways of thinking are controlled by our economic trade. And in a capitalist society, we begin to think of each other as commodities, as things to trade, like cattle. And one of my favorite Marxist theorists, and why I feel like I'm a pig in shit today, was one of the founding people at the New School. His name was Erich Fromm, and he came from these people that were combining Freudian thought and Marxism, called the Frankfurt School and later critical theory. And he was very, very concerned about this way in which we treat each other as things. things to trade, things with a monetary value. So what happens when we tie that, this kind of way of thinking about people as cattle, as things, with this disease model? We end up with the world's greatest sales pitch. You need my product. You don't know you need my product. If you don't accept my product, something's wrong with you. You're acting deviantly. You're not taking care of yourself, and I'm an expert, and you're not following my advice. You tell me that your parents are saying you don't need to buy my model, but your parents are in denial, and they're enablers. And you're part of an entire sick system. And that sick system has to also come for treatment. And if it doesn't, you're all not complying. You're all acting deviantly. This is an engram that I exaggerated on. So I put in these words here, addiction is a disease. And you see where it takes off, this idea of addiction as a disease. And up until that point, there was some science on this. Some doctors talk about it as a disease, but it's mostly the treatment community that's talking about it as a disease. And then came the Mental Health Parity Act, which was when the government said that insurance companies have to pay as much for behavioral care as they do for physical care. And venture capitalist firms began to buy up addiction programs. And addiction as a disease became branding. It was a Nike swoosh of addiction. Oops. So I've been pretty abstract right now, and I'm going to go to more grounded now. And I told you about Marx in 2 minutes and Foucault in 2 minutes. So it's sort of like a TED Talk where I give a lot of kind of information that's probably all inaccurate, but it sounds interesting. But I want you to think about these 5 things. This patient role, this idea that this is a clinical issue that doctors sort of deal with, that it's a disease pitch, that people engage in it voluntarily, and it's focused on sort of getting people to see that they need to voluntarily engage in treatment. I'm going to show you a video that I've titled, Take Your Pop-Tart and Go to Your Room.
Fresh air.
Okay. Are you?
Lucky Charms, the part of this good breakfast with 8 magical marshmallows.
Okay. Are you?
I know! I have a problem.
Actually, he really needs help.
Sunshine Coast Health Center is here for families struggling with addiction. Call toll-free 1-866-487-9.
Are you?
Are you or a loved one suffering with addiction to opiates or prescription painkillers? There is hope. Medication-assisted treatment is the proven most effective method for opiate addiction recovery. Utilizing medications such as methadone, Suboxone, and Subutex, combined with outpatient counseling therapy, you can achieve lasting recovery. We accept most insurance. Call Treatment Centers of America today.
Please call 800-573-4961. That is 8.
Are you?
I want cereal.
Take the Pop-Tart and go to your room.
I hate you.
Little brat.
Don't let addiction destroy your family. Destroy your family. Destroy your family.
When they need it.
Ask your doctor if your heart is healthy enough for sex. Do not.
Are you?
Don't kid yourself.
Addiction is an epidemic. We all know what happens when you don't deal with addiction. Someone dies, or even worse, they hurt others. Addiction is a disease. We are the Addiction Network. And if you've been trying to quit your addiction to drugs or alcohol without any luck, then you need to call the number on your screen now. We'll connect you with someone who's been where you are. You can't beat addiction on your own, so make the call now. The call is free, the consultation is free, and the referral is free. If you have private insurance, your treatment could be covered with no out-of-pocket cost. So call the Addiction Network now. Get the help you need.
Also dealing with a guy in his 50s who discovered Final Cut Pro, so. So how does the paradigm shift? Well, Foucault talked about where there is power, there's resistance. That when you're in the moment of being looked at, some people look back. They shine a flashlight into that panopticon to see who's looking at them. And they begin to criticize and use their knowledge to look back.
For Christ's sake, what's funny about that? Well, Jesus, I mean, you guys do nothing but complain about how you can't stand it in this place here, and then you haven't got the guts just to walk out? I mean, what do you think you are, for Christ's sake, crazy or something? Well, you're not. You're not. You're no crazier than the average asshole out walking around on the streets, and that's it. Jesus Christ, I can't even believe it.
In my field, in the psychiatric community, there's actually a significant history of people who have complained about the way in which behavior is medicalized in a way that they find injurious to themselves. It's called the recovery movement or the ex-patient movement or the anti-psychiatry movement. And in some ways, my field has incorporated those thinking. We now have peer specialists working with us, and the idea that recovery of hope and faith in oneself is an important part of psychiatric recovery. And we also have a long history of scholarly work that's critical of the model. It's only now that books are coming out more seriously about this disease model in addiction, and that's probably because addiction and substance abuse have been more voluntary treatment than the coercive treatment imposed on psychiatric patients. But it is happening, it is changing, and that's where the shift would happen in conferences like this, where we begin to look back at this clinical gaze. And I'll talk about that more in a little bit, and I'll talk about Marx's view in a little bit more too. He believed that in every way of thinking, every ideology are the seeds for the revolt. In other words, the more an ideology consolidates, it actually creates an opposing ideology. And I'll show you an example of that in regards to addiction in a little bit. But the most famous person in regards to paradigm shifts is the guy that really kind of invented the term, and that's Thomas Kuhn. And he talked about scientific revolutions. And Kuhn was interested in this duck-rabbit phenomenon. He was interested in this idea that it's not really scientific discovery. It's not new data that causes change in how we see as. It's all kinds of forces. It's all kinds of things happening where we begin to see the world and see things differently, using a different field, a different discourse, a different paradigm. See, when you're engaged in a paradigm, you're engaged in a kind of cognitive dissonance, where you have this view and you hold on to it, and anything that goes against that view you see as an anomaly, just something on the outside. It doesn't quite make sense, it doesn't quite fit, but it's an anomaly. And you place it there because you want to have your belief and your paradigm in front of you. But then those anomalies begin to build, and they become discrepancies. They become too powerful. And then slowly they become, that's that third circle, a new paradigm. So what are the discrepancies in this disease model? One of the big discrepancies, it's such a pronounced discrepancy, is how little current treatments work. Now, I have friends and people I firmly respect who are committed to AA and believe that AA has saved their lives, and I believe AA has saved their lives. But the research on AA, some of the research says it's 5 to 8% effective. Now there's professional treatment you can go to. Professional treatment doesn't have that much better an effect over 5 years. A matter of fact, people who don't go into professional treatment get well as much or more so after 5 years than people go into professional treatment. Which means we're talking people into treatments, and we're telling them they're bad if they don't engage in those treatments, to things that work as well often as not going into treatment. That's clearly a discrepancy. This is kind of a Marxist discrepancy, that as these programs begin to build, they're looking for new markets, and they're pushing this new thing called dual diagnosis. Now, it's not new to people like me. I was trained to think of dual diagnosis as something we think about when we think about people with like severe psychiatric issues who are using substances. But now dual diagnosis is used to describe everything. It's a brilliant marketing plan. It's a brilliant kind of branding, because now you can say to the person, not only are you not taking care of your addiction, you're not taking care of your depression or your anxiety. You're really not looking out for yourself. You're not doing what you're supposed to do when you're diseased. But that model also leads for us to think differently about addiction, because it's saying there's an underlying psychological issue. And maybe what that leads to, too, is new thinking about who should be treating addiction. And maybe the people that should be treating addiction are people that are trained in the psychological sciences. That's discrepancy number 2. Then there are these little sleeper cells that have been with addiction treatment for years, and nobody really complained about them much. One is this: stages of change. That doesn't fit with disease. That's about a person contemplating. And that's what we all go through, not just people who are engaged in addiction. We all go through these stages of change. It's not a disease, it's this moment of contemplation. As a matter of fact, if you start intervening on a person during the stages of change at the wrong time, you're doing something almost iatrogenic. And from stages of change came motivational interviewing, which is taking humanistic psychology and applying it in some ways to addiction treatment. But it's sitting there, it's a little sleeper cell, sitting there during all this disease talk and having some profound effect in people's lives. And then we have Andrew's book. At a time when we were told you're not supposed to do psychotherapy with people who have an addiction problem because they lie, because they're too drugged out to engage in therapy, and because what we do gets so evocative that it makes them want to drink and use, he wrote this book. And then years later, we have the Adverse Childhood Experience Study, which really sort of points out that addiction might not be a disease. It might be much more tied to what happened to the person, not what's wrong with them. It might be much more tied to trauma. And then we had books that were about addiction and attachment. And I don't know how he did it, but Dr. Mate walked in right when I was about to talk about his book. And we had this profound book, this book that really kind of changed the way people were thinking about this new frame about don't look at the addiction, but look at the pain. You know, when we talk about trauma, we really are talking about something different than disease. Trauma is something that happened to you. There was an event. It's not some sort of dysfunction due to some sort of mysterious thing wrong with you. So this is what I believe we're on the cusp of, and I think a lot of you already know this. And part of the purpose of this conference is to get us all to realize that we're all part of this movement, that this is happening, that we're on this cusp. And Andrew's going to give some more examples of sort of evidence of where we're seeing that other people are thinking this way. But I have these two kinds of values, and I pick disease values and psychotherapeutic values. I believe these are psychotherapeutic values. You can call them whatever you want, but they're definitely part of this new movement. In the disease model, as I said, the person's passive, and your job is to get in there with your scalpel and remove the disease. In the psychotherapeutic model, the person is a light bulb, and they need to want to change, and they may not want to change, and there may be good reasons why they don't want to change. They have agency. In the disease model, you're curing disease. That means you can have 40 people in the room and cure all their diseases at one time because they're all suffering from the same disease and you're using the same procedure with all of them. So it comes in bulk. In the psychotherapeutic value model, you're thinking about each person as a unique individual. In the disease model, the person's dependent on experts. Psychotherapeutic model, the person's dependent on their own autonomy and their own agency. In the disease model, the reason why this person doesn't recognize they're diseased is denial. In the psychotherapeutic model, the person's making choices around their pain. Disease model, the proof that you removed the disease is abstinence. Psychotherapeutic model, the proof that you may have done some good is help somebody towards meaning and purpose and connectedness in their lives. That's where it looks like we're going. It moves us from thinking of ourselves as doctors intervening to thinking of ourselves more like farmers, setting the right soil, creating the facilitative space for change. And as we think about that, and as we think about this person who's maybe wanting to change, we begin to think about other things like opportunity. What are the opportunities out there to develop meaning and purpose for that person? And we end up with other thinkers, people who are talking about what it means to live in a world where there aren't opportunities. We have the Carl Hart. We have Dr. Mate. We have Johann Hari. We have Bruce Alexander talking about the world around the person too. So that's not where I think we're going. I think we all are seeing this happen. And it's leading to the end of our mystery. We'll no longer have to think again about what works to solve addiction. Not according to Kuhn, Marx, or Foucault. Within systems of resistance or systems of power.
Those are very challenging observations you made, Randall.
Is that book and that movie a revolutionary movie about fighting for our individuality in systems of conformity? Or is it a misogynistic movie warning us about the dangers of women having the gaze? Foucault would say it's both, that you're never kind of free of these moments of objectifying and talking about what's normal and not normal. And as we move towards this idea about pain and about people in pain, we need to keep our eyes open for where the branding goes. Trauma-informed care. In the United States, we've moved from dual diagnosis to this. Trauma becomes the new branding. We're not really thinking about the person in their context anymore. The person's often being treated by people who really aren't trained well in trauma therapy and what it means. And yet it's the new third thing. If you don't come to treatment, not only are you irresponsible in taking care of your addiction, you're irresponsible in taking care of your mental illness, and you're irresponsible in taking care of your trauma. So we got to keep our eyes open for that as we make this change. Thank you.